I'm Dr. David Marquis, and I'd like to welcome you to my website and to my practice. I wanted to take a little bit of time and share what really makes us different. It's a common question that comes up, and I wanted to give people an opportunity in a non-confrontational manner so that they can actually see me and what this whole practice is about. The real thing that makes us different is that we treat people neurologically and metabolically. And I'd like to define those two terms for you. When someone comes to our practice, they'll often come with reams of paperwork. They'll be carrying along their past history of the past 10, 15 years of all the doctors that they've visited and how their problems might have morphed into other problems but never quite resolved. And we look at these chronic conditions and we evaluate all of that paperwork, and we find oftentimes many holes within their lab work. So on that metabolic side, what we're looking for is, what does their blood lab show? Do they have any salivary lab that shows what their endocrine system is doing, so that we can take another look at their hormones and their sugar status? We like to see a stool sample so that we can get an idea of what's going on gastrointestinally. Is this patient actually able to metabolize their foods? Are they harboring organisms that are preventing their body from functioning optimally? Do they have antibodies going against themselves or against other tissues in their body or foods that they're eating? So all of this would be that metabolic picture. When we get a good idea as to what an individual's stumbling blocks are, then we can start to work with them in correcting that whole metabolic dysfunction. Well, we're not just a metabolism. We also have this thing between our ears called a brain, and that is our master organ. Our brain controls everything that goes on in our body. Now, to say that, it might sound silly, but it's oftentimes neglected unless you actually have a head trauma, in which case somebody will take the time to do an MRI or a PET scan and see what kind of trauma's gone on there. And in terms of treating it, it's generally reduced to some types of medications. And oftentimes those medications are reduced to the epilepsy-type medications because that's what we have. Well, on the neurological side, there's actually other types of testing that can be done within the field of neurology that will allow you to get an idea as to how the brain is actually firing. See, the brain has a certain pattern in which it should send signals to the rest of our body, and in turn, it should receive them in a certain pattern. Well, we've been blessed with eyes that will allow us, when examined appropriately, to see what kind of motor function we have controlling our eyes and our motor skills of our arms. And so there's some really neat tests that you can do to evaluate if an individual's hemispheres are firing in appropriate manner. And when you start to find imbalances, more often than not, those imbalances in the brain also correlate with problems that you see in the human body. For example, I might find an individual that comes to me and they've got some complaints of some gastrointestinal issues where they're not able to eat the things that they would like to eat. Well, upon exam, we also find that they have some balance issues or some coordination issues in terms of moving their hands in symmetry or meeting up one hand to their nose with their eyes closed or marching in place or a variety of different things. These subtle changes that we would take for granted generally can indicate that, well, that person might not be perfusing oxygen that well. So other neurological tests will allow us to compare what their oxygen saturation is to their perfusion index. How much of their saturated oxygen is actually getting delivered to their tissue? And an interesting thing on many of these folks where they have oxygen perfusion issues is that you'll find that they have toenail fungus on one side of the body or dominant on one side, where they have a chronically cold limb. If it gets cold outside, their limb might actually change color. And they'll write that off, so they'll say, well, I've got Raynaud syndrome, or I've just got poor circulation in that leg. Well, your brain controls that. What's wrong with that? Why isn't it doing it? And we can evaluate that. Now, the greatest thing is you can actually treat those things as well. And here in our office, we really specialize in making sure that each patient has the appropriate fuel and activation to allow their body to heal. See, all of us require an adequate amount of oxygen and an adequate amount of glucose. Well, we're breathing the air around us, And you might put a pulse ox on your finger and see that your oxygen saturation is 99%. So you say, yeah, I've got enough oxygen. But then if you change that pulse ox over to the perfusion index, you might see, well, I'm getting less than 10% of that delivered to my tissue. Why is that? Well, that individual oftentimes doesn't have adequate metabolism to allow for their glutathione to function, their nitric oxide pathways to function, and subsequently they end up with these vasospasms so that their blood vessels aren't perfusing appropriately. Or they have a brain imbalance, and that brain imbalance hasn't been treated appropriately with exercises. There are so many different exercises that we can implement, and some of the things include exercise with oxygen therapy. Sometimes it's auditory stim, sometimes it's visual stim, sometimes it's vibratory stim. We use things like an interactive metronome, which allows us to work with timing in retraining a brain to send correct impulses at the appropriate time. Well, our office does a lot to help people with these chronic conditions, and I hope that through this video you get an idea that we really care about our patients. When you come here, you're going to meet a wonderful staff. We've got 3 ladies up at the front desk that will just bend over backwards to make you feel comfortable and make sure that your needs are met. I have a commitment to my patients that I will not leave any stone unturned to find the problem, and whether it's something I can help or we need to refer out for, we'll find that out so that we can make sure that your appropriate care is met. Sometimes on the pain side, we'll implement other types of protocols. We use a high-level laser here, and it's been an extremely useful tool. I can't tell you how many of my patients have received benefit from that and found solutions to their pain. Well, I encourage you to look around the website a little bit more. Look at some of the testimonials. We've got so many patients that have found their answers to their questions here, and many of them have been kind enough to leave us testimonials. So I encourage you to look at those as well. If you have any other questions, please contact our office. Our information is here on the website. You can go to the Contact Us page or kick us an email. I thank you for your time in watching this, and I wish you the best of health. Thank you.